The blood cancer that I have is indolent. It grows slowly, but every now and then it gets a growth spurt. One of the things I have to do is I have to take naps a lot, every day. And during this period, I was laying down getting ready for a nap, and I was just really having a hard time. Just not thinking about, you know, is it growing fast or whatever. It was just, I was futzing, and I wasn't getting really good naps. And when I don't get good naps, it's like a house of cards. It all will fall. And so, anyway, I remember laying there and thinking, okay, let's try to pick from Gretchen's buffet. What was it that might help me right now? And so I was laying there, and I remember, I thought, well, imagery. Let's play with imagery. And so I remember I had this image of the cancer was growing. But then, in my mind, I then could sort of literally put it in slow motion and said, well, let me get a better look, because that was too fast. And I just slowed them down, and I kept sort of doing that and slowing them down. And then I was just looking at this horse. I said, well, you know, it's a horse. It's okay. You know, I can deal with a horse. I can ride a horse, or I can watch a horse, or I can hitch it to a wagon. And anyway, and I fell asleep.
Patients come in for chemotherapy, and they're really anxious. A very stressful situation, dealing with a diagnosis of cancer and chemotherapy and the side effects. So I found what I was doing off and on was helping people relax while I was starting IVs or giving them treatments. And I thought, you know, this has worked so much in my life. There's got to be a way I can bring this more into the clinic.
Take a few moments to become comfortable in your chair or on the floor. Allow your mind to move away from thoughts and worries from the day. And just begin to settle in. The purpose of this time is to allow your body to experience a moment of relaxation, comfortable rest, and perhaps even tap into feelings of joy and deep contentment. By taking time each day to listen to a relaxation CD, or by sitting in quiet meditation, you will experience the many benefits of relaxation.
The Mind Body Medicine program is a 10-week wellness program. And throughout those 10 weeks, I introduce patients to different forms of relaxation techniques, because one form of relaxation does not fit for everyone. There are many different ways to elicit what is known as a relaxation response. So when you're doing a meditation or yoga or Tai Chi, your heart rate goes down, your blood pressure goes down, your breathing rate goes down, your muscles relax, and your body's in a state of relaxation. And that's not something that comes naturally to everybody. Place your hand now at your heart center. Take a deep breath in and just appreciate the ability you have to connect to this well of loving energy, which is always present.
It's fabulous. Every one of my patients who's gone to it has just been so grateful for having this available. It's a resource that really looks at sort of the whole person. It looks at everything from nutrition to yoga, to exercise, to diet, to the impact of laughter on one's life, and really helps give somebody a sense of knowing who they are, knowing what things help them deal with the stress and anxiety of living with the diagnosis of cancer, helps them feel more in control because they know that they're doing things that may be healthy for them, that may help their immune system or their overall sense of well-being. And it also is a place where they bond with other people who are going through a similar diagnosis, and that shared camaraderie, in addition to what they're learning, I think is what's so helpful for them.
I may not really like them, but I enjoy
Eating is hard.
It's sort of an
I rely a lot on deep breathing. When I'm under stress, I can calm myself down. And my doctor the other day said, "You're the only person I know that cancer cured high blood pressure." Because I was on lots of blood pressure medicine and now I'm off of it completely.
The word cancer is scarier than any other word. To find a way to make it less scary, to find companions, support, understanding, and new experiences, I think that's incredible.
Mind-body medicine is what I think of as a complementary therapy versus alternative therapy. It's something that can complement whatever therapy you may be going through with Western medicine. And the beauty of mind-body medicine and of relaxation techniques is it's something that you can do for yourself. Really, it's about getting a little more control. You're sitting there with your doctor and wanting to know the results of your latest CAT scan, and you're really nervous. You can do some breathing techniques that you learn through the course. You can actively learn how to relax your muscles so that you're not going out of your mind waiting for those test results. Or when you're going in for a chemotherapy treatment and you're frightened and scared or just don't want to be there, you can do breathing techniques to help yourself calm down and relax. The effects of incorporating relaxation techniques into your life are very profound and beyond what you might even imagine.
My cancer experience and my experience going through this mind-body program made a huge difference in my life. And I do think it was a gift. The cancer and this was a gift. I wouldn't give up that experience. If someone could say, well, okay, we could erase the past and you didn't have cancer, but you can't have that companion experience to go with it, I would say, I'll take it then. I'll take it. I'll keep it.
In your mind's eye, begin to explore images of a person, a place, a song, or perhaps a memory that you cherish.
Guided imagery is like daydreaming. And the most common form of daydreaming is worry. So we spend a lot of time with our minds worry, worry, worry. So the goal is to flip that around and use your mind to your advantage.
I talk with a lot of people who've had either breast cancer or other cancers, and chemo is an awful time for them. It's amazing to me when I have the image of walking down the hall into the pods down there. Then it's a net warm feeling that I have.
There are many great rewards in being a nurse, and I love being a nurse. And one of the greatest rewards for me is when I hear somebody say to me, oh, I did guided imagery the whole way through that bronchoscopy I had to go through last week, and it really helped me. Or the other night I woke up in the middle of the night and I couldn't sleep, and I popped in a relaxation CD, and before I knew it I was relaxed and I was falling asleep again. And for me that's the most rewarding thing to hear, because that means that, that they're getting it, and the work I'm trying to do is helping somebody else to get through a difficult moment. And that's what I really want to do, is to help people get through the difficult moments. That's the whole goal of this program, is to help people get through the difficult moments.